Bismillahirrahmanirrahim. I'm Dr. Mohibullah Wazir, and the topic is the axillary artery. Look, axillary artery is, it's the continuation of subclavian artery. Alright? Subclavian artery originate from the arch of aorta on the left side, and it originate from the right brachiocephalic trunk on the right side. And then this subclavian artery ascend upward into the root of the neck, and over here it gives many branches. Then this subclavian artery it turns laterally and downward. Look, this one, this you can see, this is the subclavian artery. It passes posterior to the clavicle along with the cords of the brachial plexus behind the mid part of the clavicle to enter into the axilla. And note the point that, look, this is the first strip. This subclavian artery passing like this from the outer border of the first strip downward, then it is called as axillary artery. Alright, you look over here please. Look, this is the clavicle and this is subclavian artery, and subclavian artery, as soon as it crosses the lateral border of the first strip, it becomes the axillary artery. And the axillary artery then runs downward, and as it crosses the lower border of the teres major, then it becomes the brachial artery. In this way, subclavian, axillary, brachial, it is continuous one artery, but lying in the root of the neck, it is subclavian from the outer border of the first strip till the lower border of teres major, it is axillary, and from the lower border of teres major in the brachium, then it is called as brachial artery. Okay, then the axillary artery is being crossed by, look, the axillary artery is being crossed by this pectoralis minor muscle. That's why, for descriptive purposes, the axillary artery is being divided into three parts. Okay, number one, the part from the outer border of the first strip till the upper border of pectoralis minor, this is the first part of the axillary artery. And the part posterior to the pectoralis minor, this is the second part. And the part from the lower border of pectoralis minor till the lower border of the teres major, this is the third part of the axillary artery. And then from the lower pectoralis teres major, this is the brachial artery. In this way, three parts of the axillary artery. This is for descriptive purposes. Okay, now what are the relations of the three parts of the axillary artery? The same you can see over here. Look, this is subclavian, first part, then this is pectoralis minor, second part, and then this is the third part, this is teres major, and then this is the brachial artery. Okay, now look over here again. What are the relations of the axillary artery? Look, the first part of the axillary artery, it lies over here. It lies over here. Look, this is pectoralis minor. In this gap over here, the axillary artery is the first part. And note, this is pectoralis major. Then this is the pectoralis minor, and over here is the clavipectoral fascia, and it is over here the cephalic vein pierces through the clavipectoral fascia to enter into the axillary vein. And now note the relations, please. The first part of the axillary artery, look, most medially is the axillary vein, then later to that is the axillary artery, and then superior later to that is the three cords: medial cord, posterior cord, and lateral cord. Or it may be the medial cord is posterior and the two is superior, lateral. In this way, lateral relations are the three cords of brachial plexus, medial relation is the axillary vein, and anterior relation over here you can see is the pectoralis major, and then the clavipectoral fascia, and then the cephalic vein, and then the artery lies posterior or behind the pectoralis minor. This is the second part. Now the second part of the axillary artery over here, this is the second part. Now look the relation of the second part. Medial to it is the medial cord of brachial plexus. Later to that is the lateral cord of the brachial plexus. Posterior to that is posterior cord. That is the three cords with the second part of the axillary artery get the relation according to its name. Now the relations in the second part, this is pectoralis minor. Most medially is the axillary vein, then is the medial cord, then is the axillary artery. Posterior to the axillary artery is posterior cord, and later to that is the lateral cord, while anteriorly it is being covered. Now you can see the pectoralis major and then this pectoralis minor. This is anterior relations, while later to that is the lateral cord of brachial plexus, and medial to that is axillary vein and medial cord of brachial plexus. Now what are the relations of the third part of the axillary artery? Look over here. The third part of the axillary artery over here, look, this is the posterior wall of the axilla. Posteriorly over here, you know, to the axillary artery lies the posterior cord, and then you can see the subscapularis, and then you can see the teres. You can see this is subscapularis, and then the teres major, and then the tendon afflectus dorsi. These are the posterior relations. Tendon afflectus dorsi, teres major, and subscapularis, and posterior to that is the posterior cord and long with its branches. And later to that you can see over here is the lateral cord of brachial plexus. From the lateral cord of brachial plexus, then you can see the musculocutaneous nerve, this one. This is also in its lateral relation. And then you can see this coracobrachialis and short head of biceps. These are the lateral relations of the third part. Short head of biceps, coracobrachialis, musculocutaneous, and lateral cord. And medial to that you can see this is the medial cord of brachial plexus, and most medial to that over here is the axillary vein, and lower down between the axillary vein and the axillary artery, this over here lying between the two, the axillary vein and the axillary artery are two nerves. That is, the superficial one is medial cutaneous nerve of the forearm, and the deeper one is the ulnar nerve. These two structures lies between the vein and the artery, one upon the other. The superficial one is medial cutaneous of the forearm, and the deeper one is the ulnar nerve. While posteriorly are all these muscles, and anteriorly over here you can see the tendon of pectoralis major. These are the relations of the third part of the axillary artery. Now, what are the branches of the axillary artery? Look, the branches of the axillary artery can be summarized that one branch from the first part, two branches from the second part, and three branches from the third part. Okay? Now look over here, please. From the first part, over here, look, one small branch originates, that is the superior thoracic artery. Okay? And then from the second part originate, number one, you can see the thoracoacromial trunk, and number two, the lateral thoracic artery. You know the thoracoacromial trunk, it comes out from over here by piercing through the clavipectoral fascia. Thoracoacromial trunk, it comes like this by piercing through the clavipectoral fascia and divides into four branches: the clavicular branch to the clavicle, the pectoral branch to the pectoral region muscles and also to the breast, and the deltoid branch given to the deltoid muscle, and the acromial branch given to the acromial area and to the muscle in that area: acromial, deltoid, pectoral and clavicular. While another branch that is given from the second part, it runs along the lower lateral border of pectoralis minor, that is lateral thoracic artery. This one, it runs over here like this. Look, this artery. Look, this one, lateral thoracic artery. This lateral thoracic artery, it runs along the lower lateral border pectoralis minor muscle, and in addition to supplying the pectoral muscle, the lateral thoracic artery is also one of the important blood supply to the lateral part of the breast region, lateral thoracic artery. And then from the third part, three branches originate. Look, one branch, that is the subscapular artery. Note the point. The subscapular artery is being given, look, by this third part of the axillary artery. It passes over here and immediately divides into two branches. One branch passes through this triangular space, the subscapular divided into two: circumflex scapular, which passes through this triangular space to come onto the dorsum of the scapula and take part in the scapular anastomosis. Circumflex scapular, by turning around the lateral border of the scapula, and over here it take part in scapular anastomosis. And the other branch, look, this one, it divided into two: circumflex scapular, subscapular divided into two. Circumflex scapular, and then this thoracodorsal, which passes along with the thoracodorsal nerve to the posterior side, that is to the latissimus dorsi muscle over here, posteriorly to this muscle, along with thoracodorsal nerve, which is a branch of posterior cardiobrachial plexus. Okay, and then two branches from the third part. Look over here, please. One passes anterior to the surgical leg, and one passes posterior to the surgical leg of humerus. And this is anterior circumflex humeral, and the one which passes posterior to the surgical leg along with the axillary artery through the quadrangular space, and that is the two arteries, they make a circular anastomosis around the surgical leg of the humerus. One passes anteriorly and one passes posteriorly, anterior circumflex humeral and posterior circumflex humeral. This supplies over here the bone and as well as gives branches to the glenohumeral or to the shoulder joint as well. This is the anastomosis around the surgical leg of humerus. In this way, one branch from the first part superior thoracic, two branches from the second part thoracoacromial and the lateral thoracic, three branches from the third part, that is subscapular, anterior and posterior circumflex humeral arteries. This is all about the axillary artery, and I hope you have got it. Thank you very much.